Thank you for coming 2025 summer internship presentations from the East West Medical Group and American College of Integrated Medicine. And we've been training the students graduate, going to graduate from the Cal State Fullerton, and we help them to pursuing their dreams. We also encourage all the students utilizing knowledge to making research and making presentations and then to enrich their portfolio when they apply for the medical education. So and also I would like to use this opportunity to thank Dr. Cohen. He is the person makes the whole programs happen. So I'd like Dr. Cohen say something. Thank you, Dr. Cohen.
Thank you, Dr. Sai. You're very kind. I've been fortunate to work with an exciting group of interns this summer session, and we have Victor Amaro, come on up. He's going to speak on cystic fibrosis to us. If you can let us know what you've learned.
Okay, my name is Victor Amaro. My presentation is on cystic fibrosis. I've been working on this for over 2 weeks already, and this is what I have to offer. So first things first, these are the learning objectives, so that after the presentation, we at least take something home. So after this presentation, we understand the effects of cystic fibrosis, and from this point on, I will be referring cystic fibrosis as CF, just to make things simpler, or more simple, I mean. And the second would be cognizant of the difficulties that CF patients have, recognize the causes that can make CF worse, know the types of treatment for CF and why they work, tell the history of CF and its discovery, and any relevant information that can help you out in the future. So what is cystic fibrosis? Basically, cystic fibrosis is a mutation, a genetic mutation in the CFTR gene that causes mucus to be thicker and produce more. And this mucus clogs the airways, traps bacteria, which then leads to infections and other difficulties in the respiratory system. And there's currently over 2,000 different mutations of CF, which are classified into 5 different classes. Another thing to add is that this disorder also affects the pancreas, making it difficult to absorb nutrients and just digest food in general. And I had a YouTube video here. Let's see what pops up. Okay,
Go on to the computer.
got it, sir.
May not load. There you go.
Okay. This is going to elaborate further on
Cystic fibrosis, or CF, is a genetic disease that affects multiple organs, including your lungs, and limits your ability to breathe over time. Your main airway, called the trachea, branches into each of your lungs. The largest airway within each lung is called a bronchus, and each bronchus branches into smaller airways called bronchioles. Normally, airways are coated inside with a thin layer of fluid and mucus. The mucus catches dust and germs from the air you breathe in. Then, hair-like projections on the airway surface, called cilia, push the mucus, trap dust, and germs out of the lungs. In cystic fibrosis, the mucus is so thick and sticky that the cilia can't push it out of your lungs. This thick, sticky mucus can build up, trap germs like bacteria, and block your airways. Because of this, you may periodically have acute infections or exacerbations of the disease, causing symptoms such as increased coughing, production of mucus, and shortness of breath. As the disease progresses, long-term damage can occur in your lungs. This happens when germs, like bacteria, get into your lungs and cause chronic infections and inflammation. But there's a lot you can do to control the infections and slow the progression of lung damage. Talk to your CF care team about how the different parts of your treatment plan can help keep you healthier. As your partner, they can help you find ways to fit your treatments into your daily care routine.
I put pause on that. Next slide. Okay, so how is it diagnosed and how do we know we have it? So we have the four main ways. Well, really three, and the other one is just other specific testing. But the first one that's mainly known is the newborn screening, the sweat test, and the genetic testing. And the newborn screening here, we grab the bottom of their foot, we poke their in these areas on the side, not the middle because the nerves are at, but the sides. We get a blood sample, and it's called the heel prick test. We just measure for the IRT, which is the immunoreactive trypsinogen. This enzyme is often elevated in CF babies, and this is usually done right after birth. So this is the first way of actually diagnosing CF. And then next we have the CF sweat test. I use these diagrams. They look I don't know why these diagrams are so long. I know it looks funny. And then so it consists of this is known as the gold standard test. And basically we look for pilocarpine, which is applied to the skin to make the sweat glands activate and produce sweat. And anything above or equal to 60 millimoles per liter is positive for CF. Anything between 30 and 59 millimoles is I guess regular. It's known as just a good level, and anything below that is unlikely to be CF, which is something else. And genetic testing, we'll elaborate more on this later on. But it just goes to show that you could be a carrier of CF, not I guess suffer from it and not have the symptoms, but you can still be a carrier from it. And if both of your parents have they have the genetic and they're carriers, there's a 25% chance of actually being born with CF, and another 25 of not being born with CF and without being a carrier. So 37%, according to an article I was reading, this is a percentage of people who die from CF under the age of 30, and the average lifespan of a human in the U.S. is 77 and a half years old. So you're basically living less than half the age than you typically would. Just to keep that in mind. So where did cystic fibrosis really come from, and what did it derive from? So it arose from a genetic mutation in the CFTR, which is the cystic fibrosis transmembrane conductance regulator, most notably the delta F508 mutation. And this condition is believed to derive from early European populations in two different waves. Initially, possibly with the Basques of Spain around 50,000 years ago, and later around 10,000 years ago, meaning the first wave was 50,000 years ago, where it first began, and then 10,000 years ago is when the second wave, I guess, occurred again. And then compared to other mutations that usually offer benefit, such as being camouflage or just being bigger in general, this mutation doesn't really pose any beneficial. It doesn't really help you. So it's kind of like it kind of leaves us dumbfounded, wondering why we got this mutation if it doesn't really help us. And these are the statistics and the carrier rates. You can see in the United States we have around 40,000, and again in Europe it's a higher number because that's where we initially derived from. And then it just shows that a person needs to inherit two copies of the mutated CF gene, which is what I was talking about from the last slide, saying that both parents need to be carriers in order to actually obtain CF. If only one parent is a carrier, you initially won't obtain CF, but you will be there's also a small chance that you might inherit the carrier trait. And here it shows which exact organs are impacted by cystic fibrosis. So the most notably one is lungs. The mutation gene protein helps regulate the movement of salt and water in and out of airway cells. And when this genetic mutation is effective, mucus becomes thick, sticky, and clogging airways and trapping bacteria, and then also creates these the mucus plugs, which also stops airway from coming in and out, which is potentially dangerous. The pancreas is another one that was also a big one. Is that the gene dysfunction leads to thick secretions that block pancreatic ducts. This prevents digestive enzymes from reaching the small intestine. So basically, when you eat and you want to absorb all the nutrients from fruit, anything nutritious, you won't really get those nutrients. So they will just pass out like you never obtained them. And then the intestines. So cystic fibrosis causes abnormally thick mucus in the intestines and slows down motility. Pancreatic enzyme deficiency also affects digestion here. And for the reproductive organs, I'm pretty sure it's around 98 from what I was studying. 98% of males are infertile because the vast difference from the that goes from the testes all the way to the penis is usually covered in mucus and blocked off. And for females, they're not that they're infertile, but more that the mucus in their uterus is too thick for sperm to pass through. So that also makes it difficult to for females to get pregnant from if they have cystic fibrosis. So here's the symptoms, which is the most notably one because you usually hear them cough, gasping for air, wheezing, but usually cystic fibrosis is caused by again the mutations in the CFTR gene, leading to thick, sticky mucus that clogs organs, especially the lungs, pancreas, liver, and intestines. This causes a wide range of symptoms, most of which start in childhood. The first one is the respiratory system, chronic cough, meaning that it's going to stay with you for the rest of your life. Mucus buildup irritates airways, wheezing because of narrowed inflamed waves, shortness of breath, frequent lung infections, and nasal polyps and sinusitis. And over here on the digestive and nutritional system, we get greasy, bulky stools. That's because of malabsorption of fat and also because of the pancreas because it's not digesting the food correctly. Foul smelling stools or gas, again, because of the pancreas. Or weight gain or growth, and that's also, again, because of the pancreas because we're not absorbing those nutrients. We're not digesting the food correctly. We don't absorb what we need. And abdominal pain or distension because of blockages, thick intestinal mucus. So this just continued of the symptoms of the liver and pancreas over there. And again, it's because liver disease or cirrhosis, thick bile block ducts, pancreatitis, and other related diabetes, loss of insulin producing cells. And then the reproductive system, as I was saying again, was roughly around 98%. And again, for the females, because of this thick cervical mucus impairs sperm motility to pass all the way up to the fallopian tubes. So treatment and management. How do we manage cystic fibrosis? So we have modulator therapies for this gene, and that's a medication. I'll get back to it again over in some future slides right now. It increases the activity of the protein that's not functioning correctly, and it focuses on the G551D and similar grading mutations. These are all these three right here are medications that patients with cystic fibrosis take in order to stimulate that one genetic that malfunction. And then we also have airway clearance therapies. This is for the mucus buildup. We have chest physiotherapy, and then some manual percussion or vest therapy, and then held medications, bronchodilators, such as Butrol. It just opens the airways to make it easier for these patients to breathe. And also hypertonic saline. So it's kind of like you kind of clear out the mucus with the thin water. And it just continues here with the treatment and management. Nutritional and digestive management, pancreatic enzyme replacement therapy, and that's again due to because the pancreas does not break down the food as it should. The enzymes aren't there, so that's why we place some enzymes in there. And then also vitamin supplements, since they are intaking their nutrients as you should. And right here we have an advanced treatment, which is more on the serious side, which is possible lung transplant for end-stage lung disease. And then we also have gene therapy, which is experimental so far. It's still in the process of, I guess, being applied into the real life world. And it's just still ongoing trials using mRNA therapy. And it's not yet the standard, but it's very promising. So since we are the East West Side medical group, I decided to put in the western side of the medicine and the eastern side of the medicine. So first we have the western side of the medicine. And in simple words, the western side of the medicine really discovered the gene mutation of what really caused cystic fibrosis, and I guess other ways to treat it and manage it. And it's really it contributed to like the discovery and understanding of CF by Dr. Dorothy Anderson, and also did a genetic testing and screening, which is now applied to around the whole U.S. and other Western countries, and also has become they have done breakthroughs with medications such as the three medications that were listed back then. And we have the eastern side of medicine, and of course, I had to put in acupuncture because why not? And although the eastern side of medicine did not really discover anything, they're more of a complementary and supportive role for helping out cystic fibrosis patients. And usually they do the holistic symptom management just by approaching cystic fibrosis by relieving symptoms and strengthening the body systems. Acupuncture, which uses to boost energy, clear lung heat, resolve phlegm, and promote expectoration. And then we have the points where acupuncture would be applied to, and we have other Chinese medicines such as herbs and the points again, as I was referring to. Okay, um, boo. So it looks like so this is me. This is me and my friend. This is my friend who has cystic fibrosis. I've known him since high school. We've been together, not like that, as in like I've known him for around 2 3 years, and excuse me. And he was a good friend. We went to prom together, and he was the one who had cystic fibrosis. He would tell me what he would go through, all the stuff he had to go through. He showed me all the medications, and I just had to feel bad for the man because you could tell he suffered a lot, but he's living a good life. Tells me crazy stories that I didn't think he'd be able to do, but he's healthy overall. Not healthy, but pretty healthy and enough to manage. And I just wanted to mention him because I did do this presentation on him, and this is a quote that really changed my mindset. Research is to see what everybody else has seen and to think what nobody else has thought. And it's a conclusion. Cystic fibrosis is a serious condition that affects the lungs, digestion, and more, but it does not stop people from living full, meaningful lives, as I've shown right there previously with Manny. With the help of medicine, daily treatments, and support, many people with cystic fibrosis are going to school, playing sports, starting careers, and dreaming big. And just again, as previously, Manny did go to college. I'm not sure which one because we are not on touch no more, but he did go to college. Well, we've learned that CF is tough, but science is catching up. New treatments are helping people live longer and healthier than ever before. And this goes back to the experimental thing with the mRNA for the gene therapy. And there's still no cure, but there's a lot of hope. And yeah, it just goes to show that we have the ability to breathe, and cystic fibrosis patients do not have the ability to breathe as clearly as we do. So we shouldn't take things that are granted to us granted. And that's pretty much it. Is there any questions? Okay, sounds like there's no questions. Thank you.